Fundamentally, we serve children and their families and the communities that they live in. But to do that, we really serve the people in the communities who are providing care to kids.
A lot of the emergency departments in the community sometimes are the first provider for any child. For a kid, especially that's critically ill, the first several hours matter the most.
Still, about 83% of children, when they go to emergency departments, are seen in community EDs, so hospitals right near you and me. And on the flip side, community hospitals typically see fewer than 15 kids a day, so almost 70% see fewer than 15 kids a day.
Procedures can be very challenging in children if you don't have the right training, especially if you don't have the right equipment.
Knowing the right doses of the drugs, knowing the right medications that they're going to give, knowing the right size of the equipment they're going to use is not only important from the provider's comfort, but also just important in the care and the management of the child.
We start with the assumption that kids are not little adults. And so whether it's in a medical emergency, a crisis, or a disaster, for providers and emergency managers to have an understanding of those needs is critical.
So we ask those questions that maybe don't always get asked. Who's coming to help? What equipment do they have? What opportunities do they have for ongoing education, training, and skills maintenance in the care for kids? Are our hospitals ready, and what do they need? We've worked for many years to provide, at free or almost no cost, ongoing education for EMS professionals as well as for school nurses. We provide a lot of online support with links to additional resources or education.
We used the Indiana EMSC toolkit that helped us define gaps in our current state versus a desired state. They made it quite easy. Just download it from the website, go through your department and check it off, and then you have an automatic gap analysis tool right there.
We have already developed some educational content for hospitals, and we also have done advocacy on their behalf. And so most hospitals don't have resources like that available at their fingertips. So look to a group like Indiana EMSC to give you that.
In our day-to-day business of taking care of kids, we're better than we ever were.
It's extraordinarily important that groups like IEMSC exist, not only to deliver education, but also to advocate for this idea that our children deserve the best that they can get.
They equip us to do our jobs to the best of our ability. They inform us. It's up to date. It's free of charge. It's easy to access.
You can rest easy that you know that the advocacy is happening in the background, that organization is working statewide with many different stakeholders to ensure that pediatric care is being thought of throughout the state.
Come visit, see what we're all about. Sign up for our newsletter. From time to time, we engage working groups to work on specific projects. Be involved with those. Call us when you need us.